Welcome to Education Session number 8. This week, we will learn more about how to better self-manage your COPD. There is a lot you can do to minimize the impact the disease has on your day-to-day life if you stick to keeping yourself as healthy as possible and maintaining your treatment plan that has been developed by you, your doctor, and your respiratory educator. We will go through a list of 5 key things that you can do easily to manage in the following slides. So here's the outline for the presentation. In today's session, we will review what COPD management looks like, the 5 key steps on how to manage your COPD, and discuss the role your COPD care team can play in your management. As we have discussed in the other education sessions, COPD cannot be cured, but there are ways to minimize the symptoms you have. This will take some work and some learning, but eventually you will become an expert on your disease and strive to stay as healthy as possible. With time, the disease will worsen, but there are key steps that you can take to slow it down, and this is where the COPD management comes into play. So the 5 key steps that you can follow to manage your disease include: prevent and slow the progression of your COPD, relieve your symptoms, improve your health and get active, prevent flare-ups, and establish your COPD team. We will discuss each of these in much more detail throughout the presentation. Step 1. Prevent and slow the progression of your disease. The best way to do this is to quit smoking. If you have already done this, congratulations. This is a huge accomplishment and something you should be very proud of. By quitting smoking, you are able to slow down the progression substantially. If you haven't quit yet, there are many resources available in different areas, as well as online or via phone, depending on your location. If quitting smoking is something you're struggling with, you are not alone. It is probably one of the hardest things you will ever have to do, but the reward will be very worth it. Please reach out to your respiratory educator or your primary care provider for more information and support. It's one of the best and most important things you can do for yourself. Step 2. Relieve your symptoms. COPD brings with it some nasty symptoms. Some of the most annoying and limiting ones include the productive cough and the shortness of breath. There are simple ways to control them once you get into a routine. Learning how to control your breathing and conserve your energy is a key skill that we will talk about more in a few slides. Lastly, having strategies on how to avoid those pesky triggers will ensure less symptoms. The easiest way to manage symptoms is to ensure that you're taking your respiratory inhalers daily or as prescribed. Many of these medications need to be taken on a daily basis for them to work properly and relieve those symptoms. These are called maintenance inhalers. These medications do not cure, but they keep your symptoms under control and enable you to continue to do the things you enjoy without having as many interruptions. It is important to note that though you still may have symptoms, even though you are compliant with your inhalers, this is all dependent on the severity of your disease. This doesn't mean that you shouldn't continue to take those puffers, though. They are working in the background without you even being aware. Another way to relieve symptoms is to learn how to control your breathing and conserve your energy. Controlling your breathing using the Pur Slip Breathing or diaphragmatic breathing methods will allow you to manage the shortness of breath before getting too winded. Try taking a deep breath in through your nose and then breathing all the way out through puckered or pursed lips. This is known as Pur Slip Breathing. The key here is making sure you allow yourself enough time to exhale fully, so there is no air left in the lungs when you go to take your next breath in. As a general rule, breathing out should take about twice as long as it takes to breathe in. The technique ensures that you avoid air trapping. Air trapping is when some air remains in the lungs and is not able to escape. This happens when the airways are narrowed because it takes a long time to empty those lungs. Think of it this way. A hose will spew out much more water than a straw because its diameter is larger. The straw will take longer to release the same amount of water. This same theory can be seen in the damaged airways. When you get short of breath, we often tend to breathe faster and shallower breaths because you are simply trying to get as much air into your lungs as possible. By breathing this way, though, we are not allowing the lungs to empty fully because it takes too long. The last way to relieve worsening symptoms, or in this case, hopefully avoid them altogether, is to avoid your known triggers when possible. If you don't already know what triggers you, you will eventually learn what things or places make it harder for you to breathe. If you can, the best way is to avoid them altogether, but sometimes this is just not possible. When unable to avoid, the most important thing is to be smart and have strategies on how to minimize exposure, or at least be aware that it could possibly trigger things. For example, wear a scarf when it's cold out, and avoid going outside on hot, humid days or when the air quality index is high. Step 3. Improve your health by getting active. I cannot stress how important this step is in the ongoing management of COPD. There are so many benefits of regular physical activity, but it can often be really challenging to convince somebody who gets breathless very quick to get up and start moving. Regular exercise has shown to increase energy levels. Pulmonary Rehab, which is the program you're currently participating in, is a combination of exercise and education for those with COPD. Your rehab team will work with you throughout your journey to help you advance with your exercise in order to improve your endurance and learn how to exercise safely with your condition. Eating nutritious foods can help you feel better. If you eat unhealthy food or don't get enough, you can be low on energy. When you're low on energy, you don't feel like exercising and your muscles get weaker. When your muscles get weak, it's harder to breathe. Good food can help you feel more energetic. Some people with COPD are underweight. They find it tiring to chew, and eating makes them short of breath. So they eat less and they don't get the nutrition or energy their body needs. If you are underweight, try easy to eat, high calorie foods, as well as nutritional supplements like Boost or Ensure. Try to eat many small meals each day instead of large ones. Ask your healthcare provider for a referral to a dietitian if necessary. We also have an education session on nutrition in the rehab portion of this program. On the other hand, some people with COPD are overweight. Being overweight can also cause problems for people with COPD. For example, if you have a large stomach, it can press against your diaphragm, which is a muscle that helps you breathe, or it could start to take up some of the space from your lungs, which will make it harder to breathe. People who are overweight should avoid unhealthy food and high calorie drinks like pop or beer, and should try to exercise more. It's also helpful to see a dietitian for advice on choosing healthy foods. Sexual intimacy is one of life's greatest pleasures, but it is often a difficult topic for many people to discuss. Plan to have sex at times when you are well rested. If you eat a very large meal or drink a lot of alcohol before lovemaking, you could get short of breath. A dose of your quick relief puffer before sex may reduce shortness of breath. Use any sexual position that is comfortable and pleasurable for you and your partner. And go slowly, don't rush. Managing your COPD is all about helping yourself, finding out all you can about the disease. Attending these rehab education sessions is a great start in expanding your knowledge on COPD, so hats off for you for attending. You may be wondering what happens if you are not active. The Dyspnea Spiral is a nice way to explain this. Dyspnea is another way of saying short of breath. With mild COPD, we often start to see some breathlessness with heavier exertional activities. For example, piling or splitting wood, carrying heavy things, rushing up a set of stairs. Nobody likes to feel like they're suffocating. So when we start to feel these breathlessness with these activities, sometimes we start to avoid doing those activities or the difficult tasks altogether. With more sitting and less activity, the muscles start to weaken and the body becomes deconditioned. Avoidance of any of the activities that contributes to breathlessness are now completely avoided. As time goes on, activities that require even less exertion will start to become difficult, to the point where activities of daily living, like getting dressed, cooking, or bathing, are just too difficult. Staying active helps keep those muscles strong and allows you to maintain some endurance so that you're able to do things longer before you have to stop and catch your breath. Although frustrating, it may take you longer to do certain tasks, but pacing yourself and getting some benefit from the exercise is worth it. So let's talk a little more about pulmonary rehab. The program you are currently taking has been modified due to the precautions that are needed to be taken during the pandemic. This is why you're doing the learning and exercise at home virtually. Normally, the program allows a safe space for participants to come and exercise and socialize with others that have the same disease. Throughout the weeks, most participants notice an improvement in endurance and strength compared to when they started. The program also consists of these education modules that you're listening to right now to provide more information on the different topics associated with the disease. After the program finishes, it provides you with the tools to continue to safely exercise on your own or join community exercise classes if available in your area. Step 4 of COPD management is preventing a flare-up. We know flare-ups are one of the worst triggers and can cause many issues if left untreated or not caught early enough. If we can avoid them altogether, this is even better. So to do this, we encourage some healthy eating, ensuring that you're getting adequate rest, taking your medications as directed, staying away from those you know are sick, washing your hands properly, especially when in public, getting your flu shot annually, and consider getting the pneumonia vaccine if you haven't already for some added protection. This slide shows the proper technique for washing hands. This is extremely important, especially now since COVID-19 is among us. Anytime in public, properly washing your hands is key. There are some common mistakes that people make, like not lathering long enough. Lathering with soap should be done for at least 20 seconds. Places that are often missed on the hands include the fingers, in between the fingers, on the top or back of the hand, and the thumb. Rinse for 10 seconds and then dry thoroughly. All or most of you should have a COPD action plan by now. An action plan is a step-by-step plan on what to look for and what to do in each stage of a flare-up. Warning signs you might be in a flare-up include green or yellow colored mucus, more mucus than normal. You may or may not have a fever, morning headaches, dizziness, trouble sleeping, more shortness of breath, and feeling more tired than normal. If you have any of these symptoms for longer than 24 hours, follow your written COPD action plan or call your doctor right away. You may have an infection that requires medical treatment. If you can't reach your doctor, go to the nearest hospital emergency department. Most action plans suggest starting to take your rescue inhaler after noticing the increased symptoms persisting for 2 days. Your plan may also have further instructions. Your provider may have prescribed you antibiotics and or prednisone to be used in the case of a moderate to severe flare-up. This is considered the yellow section of the action plan when you are starting to feel worse. Knowing when and how to use these medications is vitally important. Each plan should have clear instructions, and if you are unsure, consult with your primary care provider or your respiratory educator for more clarity. The red section of the action plan is the danger zone. This is the section you are not speaking in full sentences, you're confused or drowsy, you have chest pain, or your rescue inhaler isn't helping. At this point, do not wait. Go directly to emergency or call 911. The last step in managing COPD is having your COPD team and knowing how to reach them if needed. Your COPD team includes your primary care provider, your respiratory therapist or educator, your pharmacist, your physiotherapist if you have one, and your nurse. Your COPD team can help you navigate through the following questions or topics you may be concerned about, including all of your symptoms, especially if they are getting worse, what chores and activities you find the hardest, what you can do to keep healthy, example, how to eat well, how to exercise, what your goals are, what things trigger your COPD, if you're using more of your rescue inhaler than usual, questions about your treatment, concerns you might have about your medications or their side effects, and what to expect in the future. Some helpful hints when speaking with anyone from your COPD team include writing it down. Have the most important questions at the top. We often get sidetracked when going in for an appointment and forget to ask the most important things. Take notes as your questions are answered, and if you don't understand, ask for clarification. Be honest with him or her. Bring along all of the medications you are taking, and if you're unsure that you are taking the medications properly, ask for a medication review. Bring a friend or relative to your appointment. A second set of ears is always helpful for remembering details. Ask about programs in your community that help people with COPD. If you get home and realized you missed a question or forgot the response to a question or need clarification, call the office back and ask someone to assist you. The team is there to help you and make you feel comfortable. These relationships are so important for your ongoing support through your chronic disease. And so that wraps up your education session on COPD management. Remember, as always, if you have any questions, feel free to message us on Facebook, call the Lung Health phone line, or speak directly to someone from your COPD team that can help with any clarifications. Thank you very much for listening, and keep up the great work. Take care.